At the Qua Nutrition Clinics, bringing in nutrition gene testing was something pioneering that we did. In addition to this, the genetic labs that we work with now offer pulmonary gene report, which involves the lung system, the breath system. Now, post-COVID and the pandemic, many people are suffering with chronic respiratory issues, and to help them out, doing a genetic screening to seeing underlying issues with your lungs. For example, in this gene report, we test the following: ephemesia, chronic obstructive pulmonary disease, alpha-1 antitrypsin deficiency, pulmonary fibrosis, sarcoidosis, pulmonary tuberculosis, and acute respiratory distress syndrome. Now, all of these may have a significant impact on the breathing issues. In fact, because I work with athletes, I know that when athletes have been affected with simple things like tuberculosis or any asthma or wheezing, we have a drop in performance and we have an increase in heart rate, which means recovery is very low. Now, what if this subscribes to a 30, 40, 50, 60, 70-year-old? Everyone should breathe correctly. And in today's world, when we go to certain of the metro cities where pollution is really high, I remember this one year, I was staying in a hotel which was on the main road in the capital city of India. And although the hotel was air conditioned, I constantly had a dry cough for 3 days living in that hotel. I would keep going like that. And we live in an environment. So what if you're on the back foot with your genetics? What if you don't have strong lung genetics? What could you do? You could enhance your diet with powerful antioxidants, N-acetylcysteine, black tea, theobromelain, theophylline. All these are very, very powerful bronchodilators, which are actually found in your normal food. Like I would give you more garlic, I would give you more quercetin, which is found on the skin of which is found on the skin of apples. So there's a lot that you can do to take care of your lungs. Remember, your lungs turn over 10% every year. So in a decade, you have a brand new set of lungs. So exercising, using devices like the AeroFit or the Power Breath can enhance your lung capacity. Getting the genetic test is another way you can enhance your lung capacity. If I were you and I had sensitive lungs, I would definitely get the pulmonary gene test along with the nutrition gene test.